Brunnstrom.
A patient with a left-sided CVA.
Good morning, Ms. Brianna. My name is Ashley Cole. I'm going to be your occupational therapy assistant today.
According to Brunnstrom, bed positioning assists with recovery from CVAs. The therapist will make sure that they use proper body mechanics while assisting the patient. Bed positioning promotes postural normal alignment. It decreases the influence of hypertonic muscles, prevents contractures and deformity. Positioning depends on the dominant synergy patterns that are present. The therapist should never pull on the affected upper extremity when moving the patient.
Are you comfortable in this position, Ms. Brianna?
Yes.
Okay. Be ready.
The therapist will position the patient for bed mobility by turning the patient to the affected side. The affected upper extremity is placed in shoulder flexion, and the affected lower extremity is placed in partial flexion at the knee and hip.
Okay. So now we're going to roll you over. Put your arm on him. All right, and roll over as much as possible for me. All right, good job, Ms. Brianna. And I'm going to grab your legs. I'm going to take them off the side of the bed, okay? And I'm going to lift you up. So put your arm into this bed like that, your elbow. 1, 2, 3, let's go. All right, good job. You feel okay?
Yes.
All right, I want you to sit up here. I'm going to go grab my gate belt for you, okay? All right, can you lift this arm up for me as high as possible? All right, and I want you to slide up to the edge of the bed for me. Scoot, scoot, scoot. All right, you feel comfortable?
Yes.
All right, got this pull. Cut.
Shoulder subluxation is a result of dysfunction of the rotator cuff muscles. Activation of these muscles is needed. The occupational therapist places a lap tray on the affected side for proper alignment of the upper extremity, and to prevent subluxation and to add proprioceptive input.
The maintenance of pain-free shoulder range of motion is important in patients with hemiplegia. A good way to accomplish this is to mobilize the shoulder through guided trunk motion. Methods to ensure proper movements is by modeling.
Watch me, and I'm going to show you an exercise you can do. Make sure you use your unaffected side to help guide your affected side.
Proprioceptive input. And auditory cueing.
Does this hurt you?
No.
Okay. Make sure you stop when it hurts.
Wow.
Okay, come back. And keep going 5 more times. 2, 3, 4, and 5.
So our last exercise of the day, we're going to be working on trunk control and balance.
Sitting balance exercises help promote upright posture. The clinician should support the affected extremity as such and focus on doing weight shifts from side to side and front to back.
Let's do that again. Doing great, great job. We're going to do it 3 more times.
The clinician is giving auditory advice, and she's also giving proprioceptive input through the elbow of the affected arm.
Doing all right?
Brunnstrom.
1, flaccid extremity. 2, spastic and gross grasp. 3, movement and synergy. Hook grasp with no release.